Welcome, everyone. My name is Shannon Westin. I'm a professor of gynecologic oncology at the University of Texas MD Anderson Cancer Center in Houston. And today I'm so honored to be joined by one of my favorite people, Linda Ryan, who has metastatic recurrent cervical cancer, and she is the definition of a survivor. She's also a patient research advocate and has gone through treatment with Tivdak. Linda, thank you so much for joining me today, being willing to share your journey and being such a powerful advocate for cervical cancer.
I'm always happy to be here, and hopefully sharing my story helps others. So
Well, thank you. And I'm very pleased with Linda to bring you a special IGCS Advances and Updates discussion on recent approval and therapeutic options for patients with recurrent cervical cancer. But before we delve into some of these exciting data and Linda's story, I wanted to just make sure to level set and talk a little bit about cervical cancer. Now, cervical cancer is the fourth most common cancer among women globally, and it's anticipated that there'll be nearly 700,000 new cases and 350,000 deaths in the upcoming years. Now, the rates have been getting better. We certainly have been seeing improvements in cervical cancer incidence overall with the, of course, pap smears, but then the HPV vaccine, where the majority of cervical cancer is caused by the human papillomavirus, and with the vaccine, we could potentially prevent that. But it's not universal yet, and there's still much to be done. And although overall survival for cervical cancer is reasonable, about 70% of patients that are diagnosed with cervical cancer will live beyond 5 years. That is very different for those patients who have either high stage disease or recurrent disease. And really, we've had very little options for patients up until the last few years. We've seen a really incredible explosion of new treatments and new options for people. And we're so grateful to all of the volunteers who participated in the clinical trials that got these drugs to survivors and patients. And just to kind of highlight some of the really big new and exciting data that we've had, I'd say, certainly combination strategies in upfront advanced stage and recurrent disease have been hugely effective. Combinations including immunotherapies like pembrolizumab or Keytruda, in combination with anti-angiogenic strategies like bevacizumab or Avastin, and chemotherapy have had people living a lot longer and preventing recurrence. But unfortunately, we still see a proportion of patients for whom that is not enough. They will not be cured by that regimen and will need alternative strategies. And so today we're going to talk a little bit about one of the major alternative strategies that's come up over the last few years, and that's Tivdak. And I'll just give you a little background on Tivdak, and then we'll get into the fun stuff. So Tivdak is an antibody drug conjugate. There's lots of these drugs going on in gynecologic malignancies today, and it's a really cool mechanism where the cancers have a lock and the drug has the key. And when lock and key meet, the cancer cell absorbs the drug, and we see an explosion inside the cancer of very, very high dose chemotherapy. And it works extremely well. Tivdak targets tissue factor, which is really commonly expressed in cervical cancer. And that's why any patient with cervical cancer can receive this potentially life-saving agent. And so with that background in mind, I think it's time to turn it over to what everyone's here for, and that's Linda. So Linda, I'd love for you to kind of tell everyone in the audience a little bit about your background, about your story, how you got here today.
great. I'm happy to share my story. So I was originally diagnosed with cervical cancer in 2004. And I can't believe it's been 20 years, but I had a hysterectomy and no other treatment, which I think was it's still protocol for what my diagnosis was at the time. Since then, I've had, the way I count, six recurrences. And my first recurrence was in 2011, and that's when I met you for the first time. And during that recurrence, you had offered me a clinical trial or standard of care and, told me the pros and cons of each. And so that was the first time that I had even been exposed to clinical trials. And I always like to tell the story that trial, there were 54 women on the trial and there was a 31% response rate, which is 17 women. 16 had a partial response, and one person had a complete response, and I'm that one complete response. And the reason I tell that story is because it was at that point that I realized how important science was and how important research was in the healing of cancer patients. So since then, I've had multiple more recurrences. I have been on 3 different clinical trials. I've had chemotherapy, a couple of different 2 rounds of radiation, and the 3 trials that I was on, fascinating science, and one went before Tivdak was approved. I was on it as a trial, and so my most recent recurrence was in 2021, and I went through standard of care chemotherapy, or at least I guess that would be standard of care, and radiation, and I've had no evidence of disease since September of 2022, and I'm on Keytruda as maintenance until the end of this year. And everything has been going great. I have a scan coming up in June, but I don't anticipate any changes.
Neither do I, but we're always ready.
Right.
But I agree. We stay positive, and I really do think that we have made the right decisions over time to kind of keep you exactly where you are and have all the wonderful things happening in your life. So I love the comment on the clinical trials, because this is always what we talk about, where you never know what your benefit's going to be, you never know what the risk is going to be. You kind of try to weigh all the options and do the best thing you can, but you're living proof of sometimes of what we say is like, you may be the person that benefits the most from this. I'd love for you to talk a little bit more about, how you think about participation in clinical trials. What information were you glad to know? What didn't I tell you that you wish you had known? Those types of things I think would be really interesting for people.
So the thing that stands out the most, the first time when you had offered me that trial, you had said standard of care chemo was the response rate was about 15%. And this is what I remember, whether this is true or not, but this is what I remember. And that trial was seeing closer to a 30% response rate. So that extra 15%, my kids were young, and an additional 15% chance of living was so impactful to me. And that's what ultimately helped me decide to participate in the trial. And other trials that I've been in, they've just made scientific sense to me. When I was in the TILS trial, the whole getting back the cells that know how to fight my cancer really made sense to me. And I remember specifically with Tivdak, I think we got together at ASCO because I was kind of in the middle of, oh my gosh, what do I do now? And you had said, if you can make this work, make it work. And logistically, it was a little difficult, but I think you knew how important it was. And I felt like I was nervous that I was out of options. And I think that that's probably a common thing for patients in recurrence. Like, I've already done that. What's next? And you said, there are great things in the pipeline. And this is probably 6 years, I don't know, 5 years ago now. So that was super impactful, that I knew there was something coming, and you were familiar with the trial, and you knew about the drugs. So that made me feel good. And I certainly have trusted you with my life for so many years. So if you said do it, I would absolutely do it if I could do it. So recurrences are scary. I think they're the things that sometimes when I share my story, I'll say the day that every cancer patient dreads and also anticipates happened, when you have a recurrence, like you don't ever want one, but you anticipate having one. So.
Yeah, I just want to highlight a couple of the things you said. I think that obviously the relationship between us, right, the doctor and patient, is so critical. And it really, I advocate for this all the time. It's really on the physicians and providers to know what's out there and not just kind of stick with the same old and the standard of care. And we had participated in a lot of the early development of Tivdak. And so the drug itself was awesome. And although the main single agent study we were still trying to understand what was going on with combinations, which is why I advocated for you to go on the trial that you did. And then I think that's, you do the best you can, right? You anticipate what the potential benefits are going to be. You anticipate what the potential risks are. But, this is the perfect example of getting access to a drug prior to an approval that potentially benefited you earlier than other people were able to access it, which is one of the reasons why we just love clinical trial participation. So with that, I think let's talk a little bit about, I'd love to get your thoughts on just, why it's so important to have new drugs available like Tivdak to the survivor community.
Well, I think what I said about knowing that there's another option, that you're not at the end of the road. And I've had women tell me the doctor says there's nothing else they can do. And I think absolutely not. There has to be something else they can do. And I think patients don't necessarily to know to ask about trials. And unfortunately, not all physicians recommend them because they may not have access to them. However, I think it's so important for patients to ask about those trials because research for me has always given me hope. To know that there is something else gives me hope. And so having an option has always given me peace, knowing what my treatment plan is. I worry, of course, and then once I know what my treatment plan is, I've always felt so much better.
Yeah, I see a lot of people that come and say, "Oh, I've been told there's nothing else," and I'm like, "Well, we can be more creative. We have to think outside the box." And of course, we can get to a point where people aren't well enough to receive treatment, and that certainly can happen. But for somebody like you that is so healthy and always ready to try the next thing, there's always something else. I really do firmly believe that. So, I think one thing that we've seen as we're starting to talk about these new antibody drug conjugates and like Tivdak is concern over some of the novel side effects or the new side effects and some of the scary side effects, right? Like people hear, oh gosh, there's vision issues. Am I going to go blind? I'd love to hear your perspective on that because I think that's definitely a hurdle to overcome around kind of the discussion of these new drugs and just making people feel comfortable that they're not taking something that's going to, permanently damage them in some way.
One thing I would like to say about participating in clinical trials is I feel like being able to participate and be the recipient of the new drugs that are coming out is truly a gift. Some people will say, I don't want to be a guinea pig, but I think that has changed and it's a gift to be able to have access to that incredible science and the work that's being done. So I do think that that's important as a follow-up to that last question. With regard to Tivdak and I'll say eye issues, I know women are really nervous about that. And when I was on it, I did have some issues. For me, I've always been, and you know this, but I've always been okay with whatever the side effects are, just to hopefully live and be able to have more time with my family. I had eye issues, and it was not great, but it was more of a nuisance. It was goopy eyes, and I went to an ophthalmologist, and unfortunately, like it was so new, they didn't really know. They just said, no, I think you're fine, and kind of that stuff. But I guess maybe as the doctor, you can share that it really is okay. For me as a patient, I would say eye issues or living, I'll take the eye issues. But maybe from a medical standpoint, you could help ease women's mind or patients' mind because so many women are afraid of the eye issues.
Yeah, and I think, you bring up a good point, right? You were dealing with this early on when they were still learning how to manage those issues. And that is one of the kind of bold things about being on a clinical trial is sometimes they're learning as they're flying, right? So you're realizing, okay, we're seeing, irritation of the eyes, we're seeing these goopy eyes. What can we do to prevent those things? The good news now is that we have pretty nice guidelines and guidance around things that we can do to prevent those issues. And people that are listening that have taken this medication will be nodding and saying, yes, I have to bring my drops. I wear my eye, my cooling eye patch. And we always joke like, okay, you got your spot treatment,
Mm-hmm.
put your mask on your eyes. And But I do think that as we get smarter around how to manage these toxicities and these potential side effects, we can really prevent a lot of the things that are scary. And then I think having the data to know that the majority of the time, this is not permanent, this is not going to cause permanent vision loss, you are going to be okay. I think those kind of things can really be helpful, and it is on us as providers. And then, of course, we love our patient advocates that put that information out there and say, yes, I had these things, but I'm fine now, and and this was the success that I had. And I think that dovetails really nicely because you are the consummate advocate. You are an incredible advocate for research and for novel findings and for just really getting people to participate in their care and understand what it means to be a survivor. So I'd love to hear a little bit about how you kind of came into that advocacy work and how maybe other people can get involved if they're interested.
So for me, I think there are so many different ways you can advocate. For me, it's been research and also the HPV vaccine so that other people, don't have to watch their children go through the things that I've gone through and that kind of thing. But so I think there are so many different ways to advocate. There's peer to peer, there's the vaccine, there's research, whatever is so important to you within your journey. And you know what, it is really hard to start that, but I think talking about it, and now when I was diagnosed, even with my recurrence, there weren't Facebook groups or different things that women could get together and talk about it. So I will say, with regard to the eye issues, recently I saw a patient in one of the groups kind of talking to someone about the eye issues, and she said, just stick with do the drops and do the cold, do whatever they tell you, and it will be better. So I think that that's an important piece too. Like, as a patient, you have to be diligent about what the physicians are telling you to do. But anyway, becoming an advocate. So for me, research was really important, and I had a charity with my friends, and so we were able to fund research. And I think that every patient should be able to go into a research lab and see what these passionate people are doing to find answers and help us so that when we do have the recurrence, which we dread but anticipate, there is something available. But I think sharing your story is the most important thing you can do, because you can help other individuals, at a minimum, advocating for that, and then speaking to your doctor and developing a relationship. And we've had such a long relationship that we've gone through children and divorces and or divorce and whatever, so we've gone through a lot of things together. But I think getting to know your doctor and having your doctor know who you are and what's important to you with regard to how you want to fight for your life, it's that really matters.
And I would just say, coming from the researcher standpoint, having the patient and survivor and caregiver perspective is so critical because, we want to balance obviously success, right? And that's our primary goal, is for people to live longer, see more birthdays, all of the things. But we also want to take in mind like what people are willing and able to go through. And,
Right.
and I think that really helps, especially as we try. And we build therapeutic trials and we want to see people live longer, but we also want to understand the science behind it, and that involves things like blood draws and biopsies and all of that, and understanding kind of what's logistically feasible and what's doable, and and what do people want to hear to understand why they have to go through those things. So I think that's another place where you've been really critical, is sitting there reviewing different research trials that are being considered nationally or globally, and giving your opinion around whether or not this is something that the survivors want us to focus on, and two, something that's doable. So I think that's another place where your advocacy has been absolutely critical.
It's really been nice to see the change in people wanting to hear the patient's view and wanting to know those things about the process. And so being asked to do that it's an honor for me, but I'm so grateful that researchers and companies want to be able to make it better for the patient. So having our voice involved is really critical.
Well, great. And any other you've given so much advice to
Uh,
everyone listening today. Any other last words of wisdom before we sign off?
So I already said it once, but ask about trials. So if your doctor doesn't tell you, make sure you ask about them. And it is hard to navigate to find them, but you can do it and ask your doctor. But the one thing I always tell, I'll always have people say, so and so was just diagnosed. What can I tell them? And the one thing that I always share is don't give away your power. Cancer takes so much from us as patients that you are in charge of your cancer. And so don't give it any more power. Don't let it take anything more than it's already taking. So you own this.
I love that. Well, Linda, it was great to see you and speak with you today. So fun. I can't wait till we get to have one of our in-person hugs, but this will do for
Agreed.
now. And thank you to all of you for listening to this special IGCS Advances and Updates discussion. We'll see you next time.
Thank you.